Hi everyone, it's Healthy Lifestyle. So today we are going to talk about what we need for immunity when we exercise. So this is the second video on the topic immunity and exercise. If you haven't watched the first video, the link is here on the right above. Watching it will help you to get the full picture. So in the first video, I finished up saying that appropriate exercise strengthens immune function by using muscle as an immune organ, and that moderate recreational exercise boosts your immunity, whereas exhaustive exercise can potentially diminish it. And there is one more thing that you have to keep in mind if you want to boost your immunity. Let's talk about it. This is a model developed by scholars who researches the relationship between exercise and immune function. The name of this model is open window hypothesis. So the x-axis means the exercise cycles. So bout 1 in recovery, bout 2 in recovery, bout 3 and recovery. So y-axis means immune function, enhanced, normal, impaired. So we start from here in the normal stage. So if you exercise, the immune function will go up, but then immediately it goes down to a level lower than the previous level before the exercise. And it will take some time to recover in this way. So it takes like 3 to 72 hours, depending on the exercise type. And if you exercise one more bout before your body recovers, then the immune function will rise again, but it falls again. And this time, the level is much lower than before, and it will take much longer time to recover this way. And if you do not wait for your body to catch up and go on for another bout of exercise, the immune function will rise, but soon it goes down. It falls into the area of state of chronic immune suppression this time. So in this way, frequent exercise without giving your body to rest and recover can lead you to a state of chronic immune suppression. There are patients indeed who suffer because of too much or too frequent exercise. I'll share two cases with you. The first one was a woman in her early 30s. She had been suffering from otitis media for over a month. She received antibiotic treatment at the otolaryngology clinic for a month, but she was not getting well. It had gotten worse. She was losing her hearing. So she came to me very worried. I evaluated her lifestyle factors and nutritional factors together. I found out that she had been boxing every day, thinking that exercise is necessary for her recovery and for her immunity. So I told her, to the contrary, that exercise is no good at the point of time. Actually, exercise is the main factor inhibiting her from getting well. So I advised her to stop exercising altogether till she gets better. She was a bit disappointed because she loved exercise a lot. Anyways, she followed my advice because she needed to get well first. Then I provided nutritional therapy to correct a few micronutrients deficiency. Not long after, her hearing came back and her otitis media was completely cured. The second case is a man in mid-50s. He regularly checks his immune function by testing NK cell activity for health promotional purpose. He usually had very good numbers. He was excellent at managing his health and his lifestyle is perfect, but we noticed a sudden drop in NK cell activity. He did not have any other kind of problem, but excessive exercise was a problem at the time. So he worked out at the gym for 2 hours every day and played golf during the weekends. So practically he exercised every day, 7 days a week. So I advised him to reduce exercise and that he needs to rest from the perspective of the body. In fact, your body is working while you exercise. Even if you think you are taking a break, you're resting, enjoying the leisure, and having fun. So I recommended him to secure resting time in the body's point of view to take a rest at least during the weekends. Then when we followed up after 2 months, his immune function came back to normal. If you are a person who likes exercise, then at times you may feel heavy and not fresh if you skip exercising even one day, right? If that's the case for you, you are probably addicted to exercise. But don't worry, because exercise addiction is the healthiest addiction there is. You only need slight modification. Exercise is good. It makes your body healthy, protects you from many diseases such as diabetes, atherosclerosis, hypertension, and cancer. And it also helps you to get away from depressive mood or anxiety. The only downside of exercise, that is decreased immunity, only comes with too much of it. So, the reason why you get addicted to exercise is the endorphin. When you exercise, for example, marathon, you push yourself hard to your limit, and there comes a time, a critical point, so you feel it's difficult and painful, and you want to give up and cannot go on anymore. But if you pass the point, you start to feel better and even happier. This is called runner's high that happens because endorphin is released. The endorphin is a natural drug that your own body produces to help you overcome the pain caused by exercise. So yeah, if you're addicted to exercise, it's equivalent that you're addicted to your endorphin. So it's okay as far as you are aware of it and give your body an enough rest that it needs. Thus, to maintain your immune function in a good state, you need an adequate rest after exercise and before you resume the next bout of exercise. The recovery time varies depending on the exercise intensity and duration. So, for example, light exercise, walking for about 30 minutes after meal, usually recommended for patients with diabetes, is good to be done every day. It's not much a burden to your body. But moderate and vigorous intensity exercises need more rest. When you exercise like fast walking or cycling, you can talk to someone but you cannot sing. This is moderate intensity. And when you run, you can't say more than a few words without pausing for breath. This is vigorous intensity. So, as a rule of thumb, I recommend moderate intensity exercise to be done every other day and vigorous intensity exercise with longer intervals. Let's briefly review the WHO guideline on exercise. So here, sedentary time, we have to limit it. So we have to minimize the sitting time and replace it with some kind of physical activity. Any kind of physical activity is better than none. And for pregnant and postpartum women, 150 minutes per week is recommended. And for adults and older adults, 150 to 300 minutes per week is recommended. And for children and adolescents, 60 minutes per day is recommended. And for the adults, at least 2 days a week of muscle strengthening activity is recommended. And for older adults, at least 3 days a week of balance and strength activity is recommended. So remember here, the minimum recommendation for the adults is 150 minutes. So you divide this 150 minutes into 3 to 5 sessions and distribute those sessions evenly throughout the week. Also, the guideline says that more than 300 minutes per week can be recommended for the ones who can. But at the same time, the guideline shows you that more than 300 minutes per week of exercise may increase the risks and harm, which rises rapidly after a certain point. On the other hand, the incremental benefits of exercise actually slows down reaching a plateau. One more thing, if you're doing vigorous intensity exercise, the recommended time duration reduces to half. So 75 minutes of vigorous intensity exercise is equivalent to 150 minutes of moderate intensity exercise. If you're a person who exercises a lot, more than the recommended, then you're probably producing lots of free radicals. Free radicals are oxidative stress, so if the amount of free radicals that you produce exceed the level that your body can handle, your body will be put under oxidative stress. That can potentially expedite the aging process and it can cause chronic inflammation, which can lead to atherosclerosis and diabetes and even cancer. So if you are a person who are exercising a lot, you need to take lots of vegetables and fruits. In the next video, I will explain what oxidative stress is in more detail and how it is related to health problems. Thank you for watching and see you next time.